Want to know what comes next in treating your breast cancer? We're going to teach you all about it. Diagnosing a breast cancer and treating a breast cancer is a long journey with many steps to the finish line. In fact, it's a marathon. From breast imaging to breast biopsy to breast cancer surgery, possible chemotherapy, possible radiation therapy, hormonal therapy. In this video, I'm going to share with you the sequence of common breast cancer treatment and the timeline associated with them, so you know what's ahead and can plan your life around it. In this lesson, I'm going to share with you the time it takes to find and biopsy your breast cancer, have surgery, undergo chemotherapy, radiation therapy, and hormonal therapy. So let's get started. Breast imaging and a breast biopsy. How long does it take? Well, if you have a lump in your breast, you need an order to get a mammogram, maybe an ultrasound. It's called a diagnostic mammogram. Your physician will order that, and so you have to call and get that scheduled, and that can take anywhere from 2 days to 2 weeks. Have your physicians help you schedule that. They know how to streamline the process. If you had a screening mammogram, you walk in, get imaging, and they call you back. Sometimes that takes a week to get called back and to make that scheduled to find out if you have a lump that needs a biopsy. So all of the breast imaging is about finding something that needs a breast biopsy to make sure it's not cancer. A second part of getting your diagnosis is getting a biopsy. Most biopsies are done under ultrasound with a needle, and they're called ultrasound-guided biopsies. There are many other types of biopsies, stereotactic biopsies, MRI-guided biopsies. So getting scheduled for one of these biopsies can take several days or longer. And one way to speed up the process to find out if you have a cancer or not is ask the radiologist or the surgeon or whoever does your biopsy, give them your cell number and ask them to personally call you with the results. And tell them it's okay to leave the results as a voice message. You want to know the results as soon as they do. How long does it take to get my breast cancer surgery? Well, the average time from diagnosis to having a lumpectomy surgery for breast cancer is about 32 days. And the average time from diagnosis to a mastectomy, which takes a little bit more planning with your surgeon, sometimes plastic surgeon, is about 40 days. So this is a long process, and that's why I want to explain this to you. So once you have a diagnosis, you generally are referred to a breast surgeon, or maybe a surgeon did your biopsy, and they call you and tell you you have cancer. So it takes time to get a consultation with a breast surgeon for them to assess you, examine you, and come up with a treatment plan. A lot of times a breast surgeon will order a breast MRI at the same time they're looking forward to scheduling a surgery. So an MRI comes pretty commonly, especially if you are younger. And then ultimately you're scheduled for surgery, and then you have surgery. And after surgery, you generally have to wait 3 or 4 weeks to start radiation therapy to the breast if you've had a lumpectomy. Or if you need chemotherapy and it's determined that you do, you generally have to wait 3 or 4 weeks after surgery to have chemotherapy. So we're already blocking off another 2 months almost. It can be shorter or longer from diagnosis to either getting through surgery recovery and getting to chemotherapy if you need it, or radiation therapy if you need it next. What is the timeline for chemotherapy? Well, chemotherapy, receiving it, the different medications and options that are available to you vary greatly. So does the time frame they're given. But generally it takes time to get a consultation with a medical oncologist, usually after surgery, occasionally before surgery. And then your medical oncologist may order CAT scans and bone scans, PET scans, or an access catheter so you can get chemotherapy. And that generally takes about 10 days to 2 weeks to walk through that process if you're going to enter into chemotherapy treatment. Chemotherapy treatment typically takes about 3 to 4 months. It can be a little longer, it can be a little shorter. Sometimes there's some medications that are given over an entire year period of time. So chemotherapy is really where the marathon comes in if you need it. Most women do not require chemotherapy, but if you do, it really does make the timeline of your breast cancer treatment much longer. What is the timeline for breast radiation therapy? Well, again, this can vary, but let's take a very common situation. Most women after a lumpectomy received whole breast radiation therapy. And that can last anywhere between 4 to 6.5 weeks. So radiation therapy requires making a consultation with a radiation therapist, radiation oncologist, at the appropriate time. So this usually follows a lumpectomy surgery. So if you had a lumpectomy, you don't need chemotherapy, you're going to move to radiation therapy, you have to let your breast heal for 3 or 4 weeks before they can start radiation. And then that time sequence begins there, 4 to 6 weeks. If you've had a lumpectomy, then undergo chemotherapy, and then are going to get radiation, you have to wait about a month after your chemotherapy so your immune system comes back and will tolerate the radiation therapy better. If you need radiation after a mastectomy, and after you've had mastectomy surgery and you've recovered and all of your drains out, then you can enter into about a 6-week course of radiation therapy. So radiation encompasses a block of your time, Monday through Friday, in and out the door pretty quickly, but it's one that you do not want to interrupt with vacations and other distractions that take away treatments. So what is the timeline for hormonal therapy? If you have an estrogen receptor positive breast cancer, you are definitely going to benefit from taking hormonal therapy. And a way to describe it are estrogen blocking medications. So for many years, we recommended women take hormonal therapy for 5 years and stop at 5 years. We now recommend in general that women take hormonal therapy for 10 years because there's a little bit of a benefit from beyond 5 years to 10 years of therapy. So you generally don't start hormonal therapy until after radiation, if you're going to have radiation, or after chemotherapy, if you're going to have chemotherapy. And if you're going to have chemotherapy followed by radiation, you don't take it until you finish radiation. So hormonal therapy is begun towards the end of all of your other treatments and then continues for years to come. Breast cancer treatment is a long haul. It seems like it takes forever. The benefit, however, for you is that it offers you the time to educate yourself and engage your physicians to make the very best treatment decisions for you. Along the way, always ask your physicians and a patient navigator, if one's in your community, to help you speed up that process. To learn more about the timeline for breast cancer treatments, visit the Breast Cancer School for Patients, where we will teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.